Good morning.
Good morning.
Good morning.
Morning.
I'm not sure if anyone else is going to show or not. So, do you think I should just get started or should I wait a minute?
There's some more minutes for them and then we can start.
Do you guys know of anyone else that might be coming?
I don't.
Okay. All right. Well, so our test we're going to do on Wednesday. We're going to attempt that. So it's going to be test 3 in Intro to Clinical Nursing. And I just thought, since it's been a while since we've been over a lot of this stuff, that maybe we should get together and talk a little bit and see, what you guys remember on everything. So, so this is going to be over a ton of different chapters. I'm going to list all the chapters for you real quick, just so you're aware. So this test would cover chapter 22, chapter 23, chapter 26, chapter 35, chapter 34, chapter 36, 37, 38, 41, and 50. So it's like 10 chapters, which is kind of crazy. But the good thing about this is you have 60 questions, so they can only ask you a couple of questions about each chapter, really. So it's not like you're going to have, 8 questions on one chapter. It's not going to be like that at all. You do have 3 math on this test. So there is one that's going to be a drops per minute question, one that will be a milliliters per hour question, and another one that's just a basic, hey, I have this many, milligrams, how many milliliters should I give? That type of stuff. Okay, a couple things that I do want to point out about this test. So sometimes they'll ask you guys questions about different things you would learn in lab. So I want to go over a couple of those things first right off the bat. So with Foley placement, you guys didn't really, I don't think, got to talk about that with Molly at all because you were cut off from lab at a certain point. Am I correct?
Yeah.
Okay. So with Foley placement, if you are putting a Foley in someone, how do you know that you're in the right spot? What do you guys think?
Well, like if it's in correctly, it won't come out because you put the balloon in.
Okay.
Because like if it didn't like work, wouldn't it kind of just slide out?
Yeah, but what else are you going to see when you put the Foley in? You're going to see something happen.
Some urine.
Yeah, that's what I wanted to hear someone say. So yeah, so if you put it in the right place, you're going to get a backflow of urine into this Foley bag. And so you're going to know you're in the right spot because you're getting urine. So you will see in your practice at some point, you will have to put a Foley in someone who has crazy anatomy, who may be really obese, and it's really hard to find the right hole. I know it sounds crazy, but it's so true. So sometimes when you have to go put a Foley in someone, you need to have someone come with you and like help hold them open and maybe hold a flashlight down there or whatever, just so you can see what you're doing. So there is a question about Foley placement on this test, and it talks about what would you do if you put a Foley in and maybe you didn't get a urine return. So what would you do? What do you guys think?
Wouldn't you try and ask maybe someone else for help so that you don't keep like sticking them and trying to put the catheter in? Because I know like when I had to get a catheter for my to check if I had a UTI, I know like it was super uncomfortable. And when the nurse came in and did it the first time, she didn't do it right. And so she had to call someone else in for help and have them help her do it.
Okay. Did she leave the Foley in and then have someone else come in and try, or did she take the Foley out?
Check it out.
Okay, so this is the thing. What the book tells you to do is that if you try to put a Foley in and you don't get urine and you're wondering if you're in the right place, you go ahead and blow up the balloon and leave it there, and then
Mhm.
you would have someone else come in with you and try it again with that already in place. That way, you know you're not going in that place again, you know, that you're going into the right place. Do you guys understand what I'm trying to say?
Yeah.
Yeah.
So you would essentially have two Foleys in for a minute until you know you have the right spot, and then you would take the wrong one out,
Okay.
because that just makes you not keep going in that wrong spot, you know, because you already have that in the way there. Make sense?
Yeah.
Okay. A couple of other things that they ask about on this test would be enemas. Did you guys get to talk about enemas at all?
No.
Yes.
Did we?
We talked about it in clinicals, if that's what you mean.
Okay, well, I don't know what you know about it. That's all I'm getting at. So with an enema, if you give someone an enema, you know, there's 3 million different types, right? But generally, you know, say you get your enema bag and you fill it up with, you know, so much water. Your order will tell you, you know, what the doctor wants you to do. So maybe he'll say, give a 500 milliliter soap suds enema or something, and that'll be your order. So you'll know how much to put in the bag, and then you'll know that you have to put the soap in with it because he said it's a soap suds enema. So when you're giving an enema, what are we trying to do? What's the purpose of that?
To help them have a bowel movement.
Yes. So when we're infusing this water into them, what does the patient feel?
Is
Cramps.
it pressure?
Yeah. So they can get a lot of pressure and they can get cramping. So the whole point when you're giving an enema, sometimes people can't hold all of it in right then and there, you know. So as you're infusing this water, you have like a little clamp on your tubing. And so you're supposed to instruct the patient to say if they need to stop for a minute.
But
Because,
like
oh, go ahead.
if they feel like lightheaded or something.
Well, it's not that they're going to feel lightheaded. They're just going to feel lots of cramping and it's going to bother them. So
Okay.
once they feel all of that cramping and it's too much, just tell them to tell you to stop for a minute. And then you're going to clamp off that tubing to give them a few minutes to collect themselves before you start up again. Because sometimes you'll give people humongous amounts of fluid with an enema, and it's really difficult to try and hold all of that in. Because you, as that patient getting it, you would be instructed to try and hold that fluid in, you know, with your muscles and things, to try and hold it in as long as you can before you let loose, right? And so if they just keep infusing all this fluid, it's just going to like pour out of you, you know?
Yeah.
So always, you know, just say, hey, I'm going to go ahead and start infusing this enema. You are probably going to feel some cramping at some point. So when you feel like it's too much and you need me to stop a minute, just tell me and I'll clamp this off. That's kind of what you need to know for that question. Okay. What about like getting a clean void specimen? So if you have to get a urine specimen from someone and it's like a clean catch, how do you do that?
Don't they pee? Don't you have them pee a little bit first and then catch the rest of the sample?
Yeah. Do they have to like wipe off with
And
the wipes and stuff?
yeah, you wipe off with the wipe first, and then
Yeah.
you.
Yeah. So typically you give them a little packet of 3 wipes and you instruct them to wipe off front to back and use all 3 wipes and then start their stream. And then they're going to put the cup under to try and get a little bit after that. So that's how you would do that. What about emptying an ostomy? What do you know about that?
You're supposed to empty it when it's 1/3 to half full.
Okay.
Also the care of it, like if the stoma has a discoloration, you know when to,
Yeah,
contact a physician or something if there's an infection.
what do we want the stoma to look like?
Pink,
Pink, red, or whatever they call it,
moist.
pink.
Yeah, and definitely you want it to be moist. You don't want it to be dry. So things that would be bad would be, hey, if it's black, if it's purple, anything weird like that, because that's going to show that you don't have good blood flow to that area, and that's a big problem. So you would want to let the physician know. So you're right. So you said half full to 2/3 full is when you empty. Is that what you said?
Yeah.
Okay. So when you're emptying it, tell me the process of doing that. What would you do?
You take it off, and normally there is like a tube in. That's how we empty it from, like beneath where the bowel movement or whatever passes through. Like there is on the bottom part of the actual colostomy bag.
Okay, so that might have like a little clamp thing at the end of
Yeah,
it
the
or something
clamp on
that you
the
would
end.
undo, and then you would let all that come out. What if this was like really full of stool, like a lot? And even after you emptied it, you seem to still have a lot of stool in the bag. What could you do for that?
I
If
think
you
replace
like
the bag.
clean it out,
How do you clean it out?
do you flush like water or some type of solution in the bag and maybe let it drain out?
Yeah. So you would get like a 60 cc syringe and you would put some water in there and just squirt it up in the bag and move it around and then let it drain out. And then that will clean it out really well. Because you don't change a bag like every 2 minutes. People generally
Right.
change bags, every 5 days or something. So there may be times where you do have to like clean it out a little bit. So I just want to make sure you guys
So you
understood
just
that.
use water instead?
Yeah, just water. Hmm.
So 60 cc syringe with water.
Yep.
Okay.
Because it's not like you're, infusing that water into their stoma or anything. It's just basically into that bag. So you can clean out the bag. Okay.
Okay.
Do you guys, I don't know if you read about this or not, but there's something about a continent urinary reservoir on the test. So there may be times where you have someone who maybe has some type of cancer or something like that, where they have to get um, a urinary reservoir made. So they have ones that are continent and ones that are incontinent. So if you had an incontinent urinary reservoir that a surgeon made for you, this would mean that when you have to pee, it would just come out. You have no control of when it comes out. So this person would probably be hooked up to like a Foley bag, so it just would come out into that. Now, if you have a continent urinary reservoir, this would mean that you actually feel like you have to pee. And so when you have that feeling, you would self-cath yourself. And so the catheter that you would use to do this would just be like a normal urinary catheter, but you're going to cath your stoma, because this is like a stoma that they have built to like hold your urine in there. Do you understand what I'm saying?
And this stoma, is it right where normally the colostomy bags are too, or somewhere else?
Yeah, it'd be kind of similar. It would come out onto your abdomen in some spot.
And is it a smaller hole because it's pee, or
No,
because the straight cat?
it's pretty similar.
Oh, okay.
So basically, you just need to know that the difference between a continent and an incontinent urinary reservoir. And usually the main reason why someone would have this is because they had some type of damage, to their bladder or something, or they have cancer or something like that, where they would have to have this. Make sense?
Yeah.
Okay, so just to clarify, the continent is you catheter yourself, with,
Yes.
with the stoma, and then the incontinence, it just comes through the bag, just like some, the normal.
Yeah, like you have no control over when you pee. It just comes out when it's ready to come out. So that way, this person would be hooked up to like a Foley bag to
Yeah.
their
So
stoma.
it's just the stoma that differentiates them and the independence.
Yes.
Okay.
Okay, so just to refresh my memory, I did send you guys a thing about like tips for test 3 like a long time ago, right?
Yes, you did.
So you guys all have that still. Okay. So a couple other things I just wanted to touch on with you. There's some kind of question about documentation, and it talks about pie charting. So I know that when we were supposed to go over documentation in class, it was one that I didn't get to do in class. So I think I just recorded or something. So in this chapter, it's chapter 26. So there is a page in your chapter, page 363, and there's a box. There's a green box there, 26-1, and it talks about these different types of charting. This specific question talks about pie charting. So what pie charting is, you would chart about the problem. That's what P stands for. The I in pie stands for intervention. And then the E stands for evaluation. So it's just like a kind of a basic way of charting. So like, hey, this is their problem. Maybe they have constipation. So you talk about that in your charting. So this patient has not moved their bowels in 10 days or something. So then you talk about whatever intervention you're going to do. So you say, okay, I'm going to give them a 1,000 milliliter soap suds enema, because I got an order from my physician to do that. So you do the intervention, and then evaluation would just be you saying how that intervention worked, if it worked or not.
Okay.
Yeah.
So it's pretty straightforward, I think.
So,
But
like, do we have to study the whole chapter, the one you just talked, documentation, or is it the only question on there?
well, it's mainly just about that pie charting. But I wanted you guys to look at that specific box that I told you about because it talks more about it right there.
Oh, okay.
Okay, so page 363. Another thing that the test mentions is SBAR. What do you guys know about SBAR?
It's a standard communication that, nurses use to communicate or give reports.
Okay, tell me more. What else do you know?
It's like the S stand for like situation. I think the B is background, and
Okay.
then A is, I think the R is recommendation, and I'm not sure about the A.
Can you guys see this?
Assessment.
Yes.
Okay, so SBAR. So S is the situation, B is for background, A is for assessment, and R is for recommendation. So this is something that you should use all the time as a nurse. So you can use this when you do handoff reports to people. You could use this when you call a physician about a problem with a patient, because you would say, okay, this is the situation. My patient has a pulse ox of 82%. Earlier on in the shift, they were on room air, but now they just seem like they're really having a hard time. They're really, working to breathe. This is what their vitals are. And you give them the whole situation. And then you say, with the background, you would be like, hey, this patient is a post-op hip replacement patient. They're post-op day 5. They have a history of asthma and COPD. Give them their background. Then with assessment, you're going to say what you think should be done. So, hey, I think maybe this patient is just hypoxic, and I think maybe we should get a an ABG to check and see what's going on there. And I think that we should get breathing treatments ordered and whatnot. So you would make some suggestions. And then recommendation, or actually that's recommendation, I'm sorry. Assessment would be your analysis of what you think is going on. Okay, so hey, I think they're hypoxic. And then your recommendation would be what you think should be done. So that's kind of how that goes. So why do you think this is such a good tool for everyone to use in different situations for a nurse? Why do you think this is such a good tool to use when you're communicating about things?
Because it gets straight to the point. It tells you exactly what you need to know about the situation that you're about to get into.
Yeah. So the question that you have has to do, it's kind of general like that. It'll ask you something about why it's such a good way to communicate with people. And it should be pretty obvious when you see the options. Now, in practice, when you guys start to practice as a nurse, they actually have a sheet that spells out SBAR, and it'll have all of this stuff as a cue to you on the side. So like when you're a new nurse, if you think you're going to forget to say something important to a physician when you call them on the phone, you could write it all out and then call, so you could have that to look at so you don't forget anything. So it's kind of a nice tool to be able to use and to have. Okay, couple other things. So there is something about, and I feel like we had this on another test before. Excuse me. Do you guys remember having a question where it talks about establishing a rapport with the patient?
What?
Do you remember a question on one of our tests, which I don't know if it was this class or our other class, but it said something about establishing a rapport with the patient?
Yes.
Because I
It actually
remember talking to one of you guys about it, and someone was saying they didn't understand what rapport meant. Do you guys remember that?
I don't.
because I thought what we were talking about in terms of rapport was, trying to get to have the patients at ease before, conducting either assessments or whatever. That way they are more open to giving you the objective data that you actually want. It just makes, things much more easier.
Yes.
And they are able to actually adhere to certain interventions better if there is that kind of rapport.
Yes. So like this talks about being culturally competent with patients, and that's this, establishing a rapport is what you should do to be more culturally competent, meaning that you establish a relationship with this patient to get them to trust you and to be able to talk to you and give you information like you were just saying. Okay. So I feel like that's a repeat question possibly, so maybe you'll recognize it when you see it. What does it mean to be a kinesthetic learner?
Touching stuff.
Yeah, being hands-on, right?
Yeah.
So there is something in there about that as well. So this is going to cut me off here shortly because this says I have about 8 minutes or so left. So the other things that I want you to make sure you're focusing on, like big stuff to be looking at, look in that legal and ethical chapters quite a bit, because there's all kinds of stuff about those things. Let me find it real quick. So like in your ATI book, there's a couple chapters on that. So, I mean, you could easily go there if you wanted as well. There's an ethical chapter in ATI. It's chapter 3. So some of the stuff that the tests will go over is some of these ethical principles, like stuff about autonomy and beneficence and fidelity and justice, non-maleficence and veracity, those things. So make sure I don't know if you guys do flashcards or whatever, but make sure you know those definitions and you could give an example of each. And then, you know how we talked about making an ethical decision in class? I don't know if you remember that forever ago.
Yeah.
But basically, there's a whole thing in ATI about when you make an ethical decision on the steps and what you're supposed to do. But just remember, like, I'll just read a little bit of this to you real quick. So you identify the issue, right? And then you gather as much information as possible about the dilemma. So then you list and analyze all possible options for resolving the dilemma. And you have to review the implications of each option. And then you have to select the option that is in concert with the ethical principle that applies to the situation. So you have to like basically think about what your ideas are about it. Think about what the patient's ideas are and the family or whoever is involved in the dilemma. And then, you know, come up with a solution after you listen to all of that, and then, you know, come up with these different options on what to do. And remember, there's always an ethical committee that you could go to if you had a problem. And then in the legal chapter, the stuff in there that I want you to make sure you really look at is there. Remember, we talked about types of torts, and there's stuff about negligence and malpractice and assault and false imprisonment and all of that. There is a specific question that's like a matching question on the test that has to do with this. And you have to be able to have an example of each thing and be able to match it with the right thing. So make sure you're really looking at that stuff.
And you said it was the ATI book, which page again?
So the legal chapter in ATI is chapter 4.
Okay. Okay. Also, you were saying something about the land something. Were we still going to do it? So you tested or no?
The land school air.
Yeah.
Well, you guys were all on that call with me before. Is there anyone who didn't get to do that? If you were on that call with me, then you guys should all be fine. There's
Okay.
nothing you have to do. So what will happen is Wednesday when we do the test, I'll call another Zoom meeting, and you guys all come on here with me first, and then we'll go ahead and connect to that land school air, and I'll make sure I have you all in there so I can see you, and then we'll start the test.
So will this test be in Zoom or Canvas? I want to know where I should be opening.
It's going to be in Canvas.
Okay. Oh, okay. That makes sense.
So the whole thing with land school air, you connect to that so that I can see your screen. You know,
Oh,
that's all that is.
and we're going to
So is it
meet
gonna
at
be-
9, right? Or
What's that?
we're going to meet at 9.
So that's another thing I just want to ask you guys about, because we probably should get on early just in case we have problems, right? And then I know Mercedes is going to be needing more time, so I probably will be on way early just to accommodate that. But yeah, we should probably start early just to make sure we're good.
Can we start at the class time?
Say that again.
Can we start at class time? Because we already have farm on Wednesday morning. So
Yeah, so what time do you guys want to start? Just
I
give me
think-
a time and I'll do it.
I think
want-
1 o'clock will be fine, like last time.
1 o'clock?
Yeah.
Okay. So that doesn't interfere with anything else you have going on, right?
No.
Nope.
So let's plan on 1 then, that we'll get on and we'll get things started. And then Mercedes, I'll be on probably at 12:30 for you.
Okay.
So you'll start at 12:30 so you have more time.
Okay.
Okay. Any other questions about this?
So are we gonna be on the Zoom and then the learn school at the same time whilst taking the exams? Or-
Yeah. Yeah.
Oh, okay.
So that's the only way I can talk to you is if we have the Zoom thing going, you know?
Mm.
And then remember, once you're on Land School Air, I think that you have a chat box that you could chat with me if you had a question or something. I believe you'll still have that. Okay. All right. So make sure you review some of this stuff over the next couple days here so you're ready for this test. If you have any questions, you can get a hold of me and I'll do my best to answer you. What's your guys' view on having class after the test? Do you think we could do that for a little bit?
I have nothing else to do.
Yeah.
Can we do the test first and then
Because, you know, we'll have this test, you know, for like an hour, and then I would want to be able to give you a little bit more new information about upcoming stuff too, you know?
Right.
Yeah.
So that's tentatively what I plan on doing. So we'll worry about the test first, and then we'll worry about getting together afterwards. But okay,
Alrighty.
Okay.
all right. You guys have a good rest of the day.
You too.
All right. We'll see you later.